Assalamu alaikum. We are back, and my dear brothers and sisters, we're joined by another very distinguished doctor, and she is Elisa Bell. Is that right?
Yes.
How are you?
Fine. How are you?
Okay. Now, what is your title?
I'm double boarded. I'm a
Wait.
board certified adult and child.
This is right here. Okay.
Oh, I'm double boarded. I'm an adult and child and adolescent psychiatrist.
Okay. I see. I have to ask you all this because obviously I'm not either. But you do have something else that you want to share with us because you've apparently watched our show before as well.
Yes.
And you know Art Turner, and we need to know because, we've heard different things about Art. We personally like Art a lot. And you say that you and my previous guest went to medical school. You got scholarships based on Art Turner.
Yes. Yes. Arthur Turner gave us a state scholarship to attend Southern Illinois University School of Medicine.
Okay.
Springfield, Illinois.
So, I mean, you were excited you wanted to talk about it. Now the camera's on you, so, I mean, don't stop now.
Okay. Well, Dr. Joyce Miller and I and Dr. Diane Washington both attended Southern Illinois University School of Medicine. And the three of us, they called us the Three Musketeers, all did our residencies and our training in psychiatry. I'm a child and adolescent psychiatrist. I treat children from the ages of 0 to 18. With mental illnesses, and I also treated adults in the past. And Dr. Joyce Miller, also one of his award recipients, she treats adults,
The one,
women,
the
yeah,
person we
the previous
just said.
one. And then Dr. Diane Washington, who's not here right now, she treats geriatric patients with mental illness.
So you all would call it Three Musketeers. And
Three
you
Musketeers.
You want to make sure that continues. Huh?
Yes,
Okay, so tell us a little something about you, the individual, Dr. Bell.
Well, I was born and raised on the west side of Chicago. I like to tell everyone I was really reared by my grandmother, who's from Yazoo, Mississippi. She's now not with us. She's deceased now. And I went to school on the west side and ended up going to Iowa Wesleyan College with prompting by my neighbor, who was an English teacher, and went on to SIU School of Medicine and did a partial residency in pediatrics. I started out in pediatrics as a pediatrician, and then went on to do an adult residency, and then went to the University of Michigan to do a child and adolescent psychiatry fellowship, and became a child and adolescent psychiatrist. I've been practicing for 20 years, and I'm what they call a community child and adolescent psychiatrist. So I've worked in various communities in the Chicagoland area, as well as in Indiana and Michigan. I'm licensed in Indiana, Michigan, and Illinois.
Okay, now, so you say you deal strictly with children today, even though you've had some work with adults. Let's talk about children, because this seems to be more of a challenge today, being a child growing up in this society. And we notice these days when there are shootings that take place in schools, they say, well, we're going to have a psychiatrist brought in to talk to the students. That didn't always take place in the black community, but now it's beginning to be more prevalent because there seem to be shootings or beatings more so than they've been in the past, and some children fear to even go to school. Is that some of your practice?
Yes, about a year ago, I worked in a school setting. Currently, I have to say I work in Gary, Indiana, at a community agency called Edgewater Systems for Balanced Living. And about a year ago, as a preference for that agency, I worked in the Gary school system, where I supervised 18 psychiatric social workers, where we would develop systems to bring children who have problems, to these social workers, these 18 psychiatric social workers, who I would staff, and they would kind of get the child to the clinic so that I would see the child. Majority of the time, children, when they first get their psychiatric intervention or care, is in the school system, but with psychiatric social workers. And that's something I'm working on now in the Woodlawn community with the Woodlawn Children's Project Zone that I'm a part of, the subcommittee of that.
Well, let me say that, what I'm seeing, across the board, many of these young children, and I want to emphasize, I listen to the language that's being spoken, especially in young girls. It just seems to be an absence of any really coherent conversation that passes by me day in and day out. I mean, some of the language that's being used, there seem to be more aggressiveness from young girls than even the boys, you know. And of course, we have some great children in the world. I don't want to say everything is all doom and gloom, but these are standouts, and that my objective is to see my people civilized. You understand?
Yes.
So these are challenges, and I see a lot of young people end up in prisons who really shouldn't have been there. They should have been caught at an early age. So give me a sense of the state of black youth right now, you know?
Right now, we're not at such a good place. What's happening in the black community over the last 20 years, particularly the last 10 years, is that there's a lack of parenting in the home. What's happening is I have, in my practice for 20 years, I've treated grandmothers with mental illness, now their daughters with mental illness, and now their granddaughters with mental illness. I believe that back in the 60s, there's at least 90% of men in the home, and now there's about 33% of men in the home.
Okay.
And this affects the family unit. And remember, it takes a village to raise a child. And what's happening, if something in the community happens that's traumatic, well, whether a young person, a young woman experiences some form of trauma.
Okay.
We see someone receive a gunshot wound. This affects the architecture and the chemistry of the brain of a young woman. This is traumatic. And if this continues, they may start developing symptoms such as post-traumatic stress disorder. When there's lack of parenting in a home, someone to help them cope and deal with these traumatic instances. This is what you're seeing. This is what we're experiencing now in our communities.
You know, I was looking for my notes because I have I get press releases all the time and things that are going on in our community, and the FBI and a federal task force just arrested a mother and son for drug trafficking on the west side. Of course, being arrested is certainly not a guilty verdict, but even the appearance that a mother and her son would be in a suite with drug dealing. And I'm saying that you mentioned you treat grandmothers. I've gone to county jail and at the same time saw a grandmother, a mother, and a daughter in jail, you know. Like there's a continuation of these kind of things. My point being to you, we talked a little bit about bipolar in the first segment with Dr. Bell. You're dealing with children. And is the alarm being sounded? I guess that's what I'm asking you, my dear sister. Is the alarm being sounded at an alarming rate so we can grab it? I mean, we seem to be losing, you know, all the way around. I mean, you know, what's the purpose of us having this knowledge to offset what is taking place if we're not going to, sound the alarm? Am I making any sense?
Yes, you're making a lot of sense. I like to tell everyone that when you put your hands on that child and you meet a child, like when I meet a child in my office, 80% of the time there's an issue with the parent, with the family, with the parent, and the parent needs help. And this is why the child has problems. The alarm isn't being sound. Right now, there is no interruption at that level with the child in order to provide the care to the entire family. The alarm is not being sound. I recently sat on a panel on the west side of Chicago with LaShawn Ford, the state rep. With the ceasefire.
The same guy who wants to call it a National Guard.
Right. I sat on the panel to discuss the traumatic.
Well, what did you think about that?
Well, I feel that I don't feel that personally myself, I wouldn't call it the National Guard because I don't believe those individuals are equipped to service the community. And I was trying to explain to him, I feel that you need to, there's so many other different initiatives we could use to arrive at that, to get to the problem. Currently there's a project called the Harlem Children's Zone Project. Have you heard of that?
Yeah, in New York. Right?
Up in New York.
Yeah.
And now we're trying to reproduce it in Woodlawn.
I'm wondering, have they ever heard of a program called the Honorable Elijah Muhammad and the Knowledge of Self, and to grab our young people and re-educate them to who they are? And I'm disturbed because LaShawn Ford, he finally became a representative. I interviewed that young man many years ago when he was trying to accomplish that. Even the superintendent of police realized that the National Guard wouldn't be effective in dealing with us in the community. And that's what I see that's missing, that many of these people that are representative, supposedly for us, are ill-equipped to understand the dynamics that are happening with our people. And as I mentioned to the previous guest, see, there are some effects that has occurred with us that we're going to have to address. And if people don't know who they are, it's very difficult for them to function in a civilized world. And I'm just listening to a lot of these band-aids that go on in the community, and we talk about discrimination. I'm also on the Human Rights Commission. I'll let people know that. And the reason I say that, because discrimination exists, in my opinion, even in the black community, when there was a program that was proven to at least educate people to the knowledge of themselves, and then you go on to do whatever you're going to do, but at least you don't walk around with a black body and a white head. And that's what I have seen, the emulation of other people, and we just don't see ourselves as a community. Pardon my, I kind of got choked up. Maybe I should be drinking water instead of coffee, and adhere to one of the teachers myself. But you understand what I'm
Yes,
saying?
I understand.
And I love your enthusiasm, and the things that you're trying to do. But I'm just saying that I thought it was foolish for someone to be calling for a National Guard for our young people in one of those shoot-to-kill orders. You know what I mean? And especially from the west side of Chicago, where I'm very close to, and I have an affection for those young brothers and sisters over there. But I'm saying that first we got to educate them. That's what we got to do. And you have a noble profession because it teaches that. And we're running out of time in this segment. It's going to be very difficult for me to complete this show on this side. So I'm going to give you 2 or 3 minutes. I can only give you 2. Well, what do you want to say as we begin to wind down?
I just would like to say that just remember that the first experience a child has, if it's a traumatic experience, that could affect the chemistry and the architecture of the brain, and it affects the emotional development, the behavioral, cognitive, as well as their attachment. That's very, very important.
So we
trauma.
should try a little love, huh?
Yeah, try some love, some parenting, some, yeah.
But you mentioned something about parenting, but it's difficult for a parent to be a parent if they don't know how to be a parent
That's
themselves.
right. They don't have the support systems, and they may be suffering from some mental illness.
I had a she's 19 now, a 19-year-old girl. In fact, I got to do something about that. And she says she's been raising herself since she was 15. And she may be in one of those programs, one of those teen programs, because she needed a place to stay. And this guy beat her. She has 2 children. She's only 19. And he beat her. It could have ruined her eye. And I was very disturbed by that because she has no brothers, no sisters. And this is why a lot of these guys take advantage of these young girls, because they have nobody to turn to. And anyway, it's tough out there, right?
Yeah.
Give a phone number. What's your number?
I have 2 numbers. I can be reached at Gary Community at 219-885-4264. That's in Gary, Indiana. Or my office number is 312-909-0606.
Okay. Brothers and sisters, we're going to have to take a break and come back, and we'll complete this show on the other side. We'll be right back. Assalamu alaikum. We're back, and brothers and sisters, I decided to bring in Dr. Bell for a few moments because, after all, it was Dr. Bell who put this together, and you were so excited about what Art Turner did, and I think it's only fitting that we give Art his flowers while he lives. He did a great thing for you all, but that shows that Art is slightly older than you all are.
Yes.
So you all were coming out of college, and he wanted to help you.
Yes, yes.
That's very good. So this is why you like to give something back to the community yourself.
Yes. Mm-hmm.
Okay.
Mm-hmm.
So, but I don't know if I got the whole 9 yards about you. What made you want to be a doctor of this sort?
Well, at around 4 or 5.
4 or 5 years old.
Well, 4 or 5 years old.
You knew what you wanted then.
I was a progressive thinker. My grandmother was very strong in the hand as far as raising me. She, well, first thing she did was taught me how to pray because I was sickly as a child. I was often, a lot of times in the hospital.
Were you?
Yes.
But you had sick as hell?
I had a lot of upper respiratory tract infections. I was underweight and had ear infections. I've probably been in a hospital probably 6 or 7 times before I was 8 years of age. And so I wanted to give back, and that's why I wanted to be a pediatrician at first, and that's why I practiced pediatrics at first at Loyola.
So you were
ago.
a pediatrician?
Yes, I practiced pediatrics. I did a partial pediatric residency at Loyola in Maywood, Illinois. But my grandmother, I told my mother and my grandmother that I believe I wanted to be a child and adolescent psychiatrist when I was in medical school because I got honors in pediatrics and I got honors in the child psychiatry rotation in medical school. But my grandmother said, go with your first mind. And so I did that and decided, I think I really want to do child psychiatry. And that's how I ended up becoming a child psychiatrist.
You know, you said your grandmother had a great effect on you, didn't she?
Yes, she did.
Well, you know, but you knew your mother quite well.
Yes.
And you
yes.
started off with your mother and father, and they were divorced. And how did that grandmother influence supersede mom?
My grandmother, my grandparents were very influential in our life from very early on, and my grandma was the matriarch of the family. And when my parents were going through a divorce, my grandmother moved in, and on weekends, my grandfather would pick her up. She had a large grocery store on the west side of Chicago.
Okay.
I believe it was on Douglas and Albany.
Okay.
And it was my responsibility on Monday, Wednesdays, and Fridays to walk a mile to the store and clean the back of the store for 50 cents a week. And I thought it was quite a bit of money. And she instituted a value system for us, for me and my 5 siblings, and gave us structure, attention, and nurturing that furthered my progression as a young adolescent and into my young adulthood and the woman who I am today.
So were you the baby of the 5?
Next to the youngest. Next to the youngest.
You know, I want you to know, Dr. Bell, you have been delightful, and I'm happy that we got a chance to talk, you know, and I appreciate that. And, you know, I found that you have been watching my show,
Yes.
and I was glad of that. But as I told you, then you should have called, you know. Next time you'll know to call.
Yes, yes,
yeah,
sir.
Okay?
All right.
Thank you so much.
Thank you.
Will you come again?
Yes, I will.
Okay.
Yes. Thank you.
All right. My dear brothers and sisters, I certainly want to thank Dr. Bell and Dr. Miller, wonderful doctors who care very deeply about people. And I'm Munir Muhammad, and I want to thank each and every one of you for watching. And may Allah bless you with the light of understanding as I greet you in peace. Assalamu alaikum.